Hi YouTube, this is Ben from Train Yourself Fit, and this is video number 2 about how to treat your own knee pain. Please check out the blog post linked in the comments below, along with the other videos about how to treat your own knee pain. When they're all put together, this is going to give you the best possible chance of healing your knee pain. So what I'm talking about in this video here is hyperlordosis and how lifestyle factors can affect you in regards to knee pain. So what's hyperlordosis? Well, what we're looking at in terms of a lifestyle factor is the fact that if you think of your muscles working in pairs, you've got your hamstrings on the back of your thigh forming one half of the pair, and your quadriceps on the front of your thigh forming the second half of the pair. Now when our legs are straight, such as when we're standing or lying down, both of these muscles are holding essentially much the same length in what is a correctly relaxed position, which means that where the tendons cross the knee like this with the quadriceps and to around here with the hamstrings, there's no undue pulling on any of the tendons at the knee, so you shouldn't be experiencing knee pain. However, when we sit down a lot, as we all tend to in our modern lives, what can happen, particularly if you're someone that sits very upright in your chair all the time, so if you think of your pelvis as being like this book, your pelvis should stay nice and level if you were to put a spirit level on there. But if you sit very upright, what can tend to happen, because the rectus femoris head of the quadriceps, which attaches to the hip up here, then down to the front of the shin here, because this shortens in order to make your leg flex like this, and it's a very powerful muscle, what tends to happen if you sit very upright is that your pelvis over time will start to lean forwards. That means that this muscle is kept in a permanently shortened state, which in turn also means that your hamstrings are starting to get stretched out, and they learn over time to maintain that stretched, weaker position. So how does this cause postural problems and what to look for? Well, a simple way to do this is just to stand in front of a full-length mirror or in front of a camera like I've got here on some sort of device. And what you're going to be looking for in the case of hyperlordosis, if you think of your pelvis, so here's my hip at the centre of the cross, you're going to be looking for having too much strength essentially and shortnesses in the muscles at the front of the thigh and also in your lower back, whilst on the opposite diagonal from the back of your leg, your hamstrings are going to be too long, as are your abdominal muscles in the front. To see if this is you, what you want to do, first things first, is to establish a baseline of a normal posture. So my posture is fairly good, but just to check what is a really correct posture for me, if I stand right up on my tiptoes, that has the effect of causing your pelvis to naturally level out. So if you take a look at what's normal posture for you, you get a comparison guideline. So now if you stand back down and take your normal posture, what you may find is that you either lean back too far like this, so that the pelvis is tilting forwards and you've got this real concave arch in your lower back. Alternatively, you might just find that your pelvis tilts forward like this, so that your butt seems to stick up too much, and again you've got that real concave arch there. Now, how do you cure this? Essentially, you've got to stretch the tight areas, which, if you remember with the cross, or on this diagonal, so from the front to your back. So to stretch these, stretching the hip flexors, your rectus femoris, assume this stretched position like so. So you stack your front knee over your front ankle and your rear hip over your rear knee, keeping your upper body nice and straight. You might already be feeling a real stretch in this back front of the thigh, which is the muscle that you're stretching. If not, what I want you to do is imagine, since hyperlordosis is an anterior or forwards pelvic tilt, what you want to do to increase the stretch is assume a posterior pelvic tilt. So you're essentially tilting your hip backwards, which will increase your stretch on that muscle. If you're still not feeling much of a stretch, what you can do to add to the stretch is to contract your abdominals, which will increase this posterior pelvic tilt even further. And if you still aren't feeling much of a stretch, what you can do is lock this tilt into place, this posterior pelvic tilt, and just lean forward slightly. Shouldn't have to go very far if you've kept this all locked in place before you're feeling the real stretch down that rectus femoris muscle, that hip flexor. Hold the stretch for 30 to 60 seconds, work up to doing that about 3 times, and do that for sort of 3 to 5 times a day, making sure to work both sides. The other area that's tight, like stated, is going to be your lower back. So you want to stretch those muscles by doing this stretch here. Come down on all fours, and with the posterior pelvic tilt, you're going to arch your back. So what you should be feeling is a stretch in this lower back, as well as in your top, your thoracic spine. Alternatively, to increase that stretch still further, whilst on all fours, deliberately drop your head down between your arms. Then what you're looking to do is to specifically stretch this lower back just by applying the posterior pelvic tilt, which is really targeting that lower back area now. And then alternatively, you can lie down on the floor, doing exactly the same stretch, but with your back flat to the floor, either holding just above the knee on the back of your leg. Pull one knee in towards your chest as far as you can and hold that again 30 to 60 seconds, or for a better stretch on the whole of the lower back, pull both knees in at the same time. Now the other side of the problem with hyperlordosis is going to be, like stated, the fact that your hamstrings are too long and weak, as potentially are your abdominal muscles. With regards to the abdominal muscles, do any exercises such as crunches, or better still, do some sort of posterior pelvic tilt exercise like a hollow hold. So I'll link my video for that down below as well, as these really are the best way to learn to contract your abdominals, and so strengthen that muscle group at the same time as addressing the posterior pelvic tilt. But for your hamstrings, body weight exercise variants you can do. It's what's called a bodyweight deadlift. What you do for that, if my right leg's my supporting leg, you're wanting to keep that support leg straight, or as straight as you can throughout the movement. Then what I'm going to be doing is just literally hinging at the hips like so, keeping a nice arch in the back by looking up. But at the same time as doing that hinge, what you want to do is lift this left leg simultaneously to form a nice straight line with your arched back, like so. Leaning down, raising the leg at the same time. Want to keep, like say, arched, so make sure to look up as the spine follows the head. Go as far as you can, feel the strain on that muscle, but don't go to a point of discomfort before coming back up. Lightly touch the floor if you need to for a rest in between before doing the exercise again, and repeat that for repetitions, perhaps up to 10 repetitions for 3 sets as you get stronger. And also, as you get stronger, you can start to hold weights in your hands, such as a dumbbell, and increase the weight over time. So these exercises will address all the problems with regards to hyperlordosis, which in turn is going to stop that tugging on the knee tendons, and that's going to go a long way to helping your knee pain if you're someone that's got hyperlordosis. Otherwise, check out my next video, which deal with the opposite postural problem and the exercises you can do to deal with that, and again address your knee pain. Hope this video has helped, and happy training.